Good morning, and thank you so much for joining us for Safe Reunions 2.0, new guidance on visitation for families with loved ones in long-term care facilities here in Maine. This program is being recorded for you today to replace the original live version that we had hoped to provide. Fortunately, though, we are able to bring back William Montejo, the Director of the Division of Licensing and Certification for the Maine Department of Health and Human Services, and Brenda Gallant, the Executive Director for the Long-Term Care Ombudsman Program. To just start off, I wanted to just provide a quick reminder to folks. At any time, if you're experiencing barriers to family visitation, any kind of barrier regarding your loved one in a long-term care home here in Maine, the Maine Long-Term Care Ombudsman Program, Brenda Gallant and her team are fantastic resources for you as family members. They can be reached here in Augusta by calling 1-800-499-0229. Or you can also find them on the web at maineombudsman.org. This program will be available on that website as well as YouTube for you to share with fellow family members or loved ones and residents as we move forward. Keep in mind that the information being provided today is a snapshot in time as of today's date. So as of May 15th of 2021, this information is current, but we know we've been living in an ever-evolving, ever-changing world. So we appreciate your flexibility. We appreciate you tuning in to listen to this information, and we hope that this helps to provide clarity. So without further ado, I'm going to go ahead and turn it over to Brenda.
Thank you so much for joining us. Every day, the Ombudsman Program hears from family members and from residents who have been very concerned about the restrictions in visitation. However, CMS has recently issued new guidance, which is opening up facilities to visitation. We know you have many questions and concerns, whether you're a family member or a friend of residents. We know how important it is for you to have information about how you can safely visit your loved ones in a long-term care facility. So we're really pleased that Bill Montejo, the Director of the Division of Licensing and Certification within the department, is here to talk with you about the guidelines that long-term care facilities must follow with respect to visitation. And I will just say that Bill has been working diligently with all the providers across the state to make sure that they understand the guidance and really in order to promote visitation in a safe manner. So Bill has some excellent information for you. If you have any questions or concerns, call the Ombudsman Program and our information is provided for you to do that. Thank you so much.
Thank you, Brenda and Danielle. For everybody, my name is Bill Montejo with the division. I'm the Director of the Division of Licensing. And I'm going to jump right in. I do want to give people the background for what are these regulations and where are these requirements coming from. And for nursing homes, assisted housing facilities, ICF, IID facilities, the recommendations and the CDC guidance and the CMS, which is the Center for Medicare and Medicaid Services, the guidance is slightly different than the general public guidance that you see that the CDC puts out. For CMS puts out guidance through the form of memorandums during the COVID pandemic. The most recent one that I'll touch base on actually came out April 27th of 2021 and actually is revised over the one that you see currently on the slide. But that is the CMS memorandum that goes by QSO 20-39-NH. And if you wanted to read that, you just simply Google QSO 20-39-NH revised, and you would get the most current guidance that the nursing homes are all receiving and following. In addition, CMS requires compliance with CDC guidance, and there is specific CDC guidance for healthcare facilities and for nursing homes and assisted housing facilities. And that's what you see here on the slide, where it talks about the interim infection prevention and control recommendations to help prevent the spread in nursing homes. These are the two primary documents and guidances that facilities are using, and I'll get into a little bit more of the details, but why the standards and what nursing homes are doing is slightly different than what you're seeing in the general public, and especially as it relates to the utilization of masks. Next slide, please. So in the April 27th guidance that I talked about, but is what we're referring to here. CMS initially released this guidance in September of 2020. And since that time, because of the use of vaccinations and the effectiveness of the vaccinations, they've revised the guidance several times. And most recently, as is highlighted here, CMS is now working in conjunction with the federal CDC to update the visitation guidance, really based on the science and what they're seeing post-COVID vaccines and related to the transmissions. There are some differences, and I want to highlight, just take briefly and highlight probably the biggest one that we get a lot of concern and confusion from individuals about is the general guidance that that people are hearing, and certainly, you know, today, late in May, we've heard about the CDC's revised guidance that just now indicates that if you're fully vaccinated and out aside, you no longer need to wear masks, and that also applies in some indoor settings. In the nursing home and assisted housing communities, that does not apply. And if you actually read the CDC guidance that was released, they state that in their guidance that this does not apply to congregate living facilities and to others, such as public transportation, buses, trains, planes, where masking is still required. And the primary reason for that is a lot of the studies are done based on kind of the general public and general population. The transmission and the susceptibility of our elderly is much higher. So there is still a need to maintain protective measures at a higher level in nursing homes and congregate living assisted housing facilities than out in the general public. And that's really the basis of why you're seeing these differences. So if currently you can go out to a restaurant and not wear masks because you and your family are fully vaccinated, but if you go into a nursing home, you will be asked, and they will require you to wear a mask. If your family member is fully vaccinated and you are fully vaccinated and you're visiting in a private room, then your family member can elect to take their mask off because everybody is in a private setting and fully vaccinated. However, as soon as you step out of that room, you will be required to wear a mask when you're in the facility, because there are others within that facility who may or may not be fully vaccinated. And there have been cases of breakthrough, which is when people who are fully vaccinated still contract COVID-19. Those are occurring here in Maine, as they are everywhere in the nation. There have been studies, most recently in a study in Tennessee and in Chicago. But the good news is the vaccines are still effective in that they are preventing deaths and hospitalizations, predominantly for people who have been vaccinated. But that's the reason why you're still being asked and required to wear masks in nursing homes and assisted housing settings. Next slide, please, Danielle. This is from that CMS requirement. Then we have put this out in guidance to facilities here in Maine as well. And this is the core principles of COVID-19 infection prevention. Facilities are required to screen everybody who enters the facility, and they are required to do temperature checks and make observations and ask questions about if you have symptoms of COVID-19. And that's a CDC as well as a CMS requirement for assisted living and nursing homes. The other thing that's still currently required as of today, May 14th, is the requirement that anybody in the facility will use source control, which is a mask. So when you're entering the facility, and facilities can and are asking if you're fully vaccinated. You're not required to show proof of vaccination, nor can they ask for proof of vaccination. But you still, even if you're fully vaccinated, are going to be required to wear face coverings and a mask while you're traveling within that facility to go and visit your family member. Facilities are also really restricting where you go within the facilities. And that is also something that CMS and the CDC are utilizing as really a best practice, because when you're entering the facility, you should be going directly, if your family member's in a private room, to that private room to visit with your family member, and then leaving when you're done your visitation, and letting the facility, making them aware that you're leaving. But you should not be going through the facility, engaging in conversations or discussions with staff or other residents. And I know this is going to be difficult for many families, because over time you've established relationships with other residents within that facility who are friends of your family as well as your family member. But during this time, that's strict adherence to this, because we are again trying to reduce outbreak in a facility, and this is really the most effective way at this point in time. Then next slide, please. We get a lot of questions about social distancing within the facilities. And again, this is right out of the CMS memorandum. So it's really CMS that's directing facilities to look at the physical plant of how the facility is designed, and to consider how the number of visitors per resident at one time and the total number of visitors in the facility at one time may affect the ability to maintain those core principles of infection control. And predominantly here, we're looking at social distancing. So in this slide, you've got the depiction of two corridors within a facility. The one on the right being much wider, can accommodate several people. The one on the left being obviously extremely narrow, and barely two people side by side can walk in that one. There's no requirement that facilities only allow enough visitors in the facility, because of, in the case on the left, the hallway is so narrow we can't maintain 6 feet of social distancing. What we're CMS and what we are looking at is a reasonable and prudent person standard, which is it is not reasonable to expect that we're going to have a lot of visitors standing in the hallway visiting. So in this narrow hallway, we would just have a real minor exposure where you would have two people passing each other who are both wearing source control in the hallway. However, if this is the only access to a group of resident rooms, and there are 15 people in that pod, a facility could limit the number of visitors, because they wouldn't want 15 people all at once traveling back and forth in this. But in those types of scenarios, we would look at a reasonable method would be to stagger visitation, so that we would have timed visits, so that we didn't have families all arriving at the same time and all leaving at the same time. That would be a reasonable mitigation method, rather than only allowing 2 families a day, for example, to come in and visit. So those are the sorts of things that facilities are considering and CMS is directing them to consider as visitation. What we don't want to see is overly burdensome restrictions. So it's really about how the facility is designed and their ability to accommodate as many people as they can to allow visitation to occur, while still maintaining principles of source control and infection prevention. So, it's a facility by facility evaluation, and it's the facility that makes that determination on a risk assessment. And if we get a complaint and are going in, and that's what we're looking at, is how did the facility determine that the limit on visitation was reasonable and what was the basis for that limit. And it really has to tie into a reasonable standard to maintain source control. My experience with facilities that we are involved with has been they're really trying, and sometimes the pendulum is still on the far side of trying to be overly protective of residents, because as many of you have seen throughout the US and here in Maine, when COVID gets into a facility, it really impacts these residents pretty severely. And, you know, prior to the vaccines really getting out there, there were a lot of deaths, even in Maine, particularly in this population because of COVID. And so that it's still, facilities are still, in my opinion, trying to be very protective. And it's taking some time to get them in, you know, to understand the changes in the regulations. And these are changing rapidly. As we're talking today, there's discussion still about the latest CDC guidance that came out yesterday. And I fully expect that we will see more changes in the coming weeks as a result of that. So again, visitor movement within the facility should be limited, as is noted here. And in situations when there's a roommate, what the facilities have to evaluate is there the ability for the roommates for visitation to occur in a dual occupancy room and still maintain social distancing and masking requirements. In most cases, there are, but that will impact the number of visitors. So if you have an older facility with fairly small rooms, you would have 6 feet of distance between somebody sitting at the bedside on bed A and somebody sitting at the bedside in bed B. This would be the scenario where we would say it would be appropriate for the facility to limit visitors, because you wouldn't want 8 people in that room visiting the person in bed A, because the risk now is higher for the person in bed B. Likewise, we wouldn't want both families in visiting at the same time, because that also creates risk coming in and out of the door together. And it decreases the probability of social distancing. So in that scenario, a facility could limit or time limit visitation in order to accommodate visitation for residents in both beds. The regulations and the requirements are all about the resident and resident-centered visitation. So that's really the goal of this, is to try and make sure that the residents' needs are being met and addressed. Next slide, please. From the most recent CMS guidance, which most recent, I'm referencing the 2039 from April 27th. Facilities and families are required to adhere to the core principles of COVID-19 infection prevention, as I mentioned previously. If the resident is fully vaccinated, the resident can choose to have close contact, including touch, with their visitor. The visitor should still wear a mask, preferably the resident if they can, but the resident, if they're fully vaccinated, can now take the mask off. And the visitor, if the visitor is fully vaccinated and they're in a private room, could take the mask off if the resident allows it and chooses. This is all about the resident's choice. However, at the end of the visit, visitors should still physically distance from other residents and staff in the facility. It's going to be difficult for many families, but you need to avoid touching, hugging, engaging with staff, and the staff will understand because they are getting this same guidance. It's all about, right now, keeping these residents protected and safe. And the other risk, as many people are still aware, is staff within these facilities are at various levels of vaccination. Some are fully vaccinated, some are only partially vaccinated, and some are not vaccinated. So there is still a risk that if an outbreak occurs in a facility, that it will severely impact staffing, which will severely impact the quality of care for these residents and the ability to have further visitation. And I'll get into that in a little bit. Next slide, please. CMS requires now when there is a new case of COVID-19 amongst residents or staff. So one case, one person tests positive, whether that's a staff person or a resident, the facility has to immediately begin outbreak testing. And that means that they shut down the visitation. All visitation stops except for compassionate care visitation, and some outside visitation can still occur. But all visitation stops and the facility immediately tests everybody. If in that first round of testing, and that it usually takes 48 hours to 72 hours in some cases to get everybody tested and to get the results back. And that's considered the first round. Everybody is tested and the results are back. If there's no other positive cases, then visitation resumes on all units except for the unit in which the positive case occurred. So if we're dealing with a facility that has 3 units, A, B, and C, and it was a staff person on the A unit who tested positive, and they did testing and nobody else tested positive, then the B and C units open up to full visitation, including indoor visitation. The A unit, under federal requirements, stays closed until another round of testing occurs. The A unit can still have outdoor visitation and compassionate care visitation. Once a second test occurs, which is usually 3 to 5 days after the first test, if there are no other positives, then they can reopen. The resident, if a resident tested positive and not a staff, that resident would be quarantined for 14 days. So in the same scenario, if a resident tested positive on the A unit, and they did full testing and the B and C units, everybody was negative, and no other resident or staff tested positive on the A unit, the A unit would still shut down to indoor visitation. Outdoor visitation and compassionate care visitation would still occur. The B and C units would reopen to full visitation. The resident that tested positive on that A unit would be quarantined for a full 14 days. Indoor visitation would not be allowed to reoccur until after 2 subsequent series of testing occurred, which is usually 10 to 14 days, and all of those cases were negative. And then the CDC, the Maine CDC, works with facilities as soon as one case is identified on the testing and the evaluation and the monitoring and the determination of when they can reopen. So, I just want everybody to be aware, this is something that is still changing and will change as the science is further evaluated. And again, this is the reason for this is to try and be protective of the residents while still allowing for visitation to occur. And it's really baby steps. We're getting there. Next slide, please. Compassionate care visits. This is directly from CMS, and the term compassionate care visit was really put out there by CMS. These are not exclusively end-of-life situations. Early on in the pandemic, there was a lot of confusion about compassionate care visits, and that was primarily because it was a CMS regulation, and CMS defined it as compassionate care, but didn't expand or give clarification. So this gives some examples of compassionate care situations for you to review. This is not an exclusive list. Compassionate care is primarily for family. The physician determines, and the focus of a compassionate care visit is that it has to address a need of the resident, not a need of the family. So the physician is involved in making the determination that this visitation is needed by this resident to help their well-being. It does allow for clergy to visit on a compassionate care visit for spiritual support. But it is really not just an end-of-life situation such as it was thought to be early on in the pandemic. Next slide, please. And this is an old slide, but I just wanted to make people aware of it because these were FAQs that came out late in the fall because of the CMS memorandum that termed compassionate care and didn't really give a lot of definition to it. And the reason I point this out to you is there have been a lot of concerns. I would go so far as to say really hard feelings between facilities and families. And it was primarily because really up until December, CMS took this position, and it's highlighted here in blue, that CMS acknowledges that compassionate care situations extend beyond end-of-life situations. CMS still believes these visits should not be routine and allowed on a limited basis as an exception to restricting visitation. We remind facilities and visitors that all actions to prevent the transmission of COVID-19 should be taken. So I just wanted to, this is really more for your awareness of why early on in this pandemic, and really up until about the end of December, it was difficult to get compassionate care visitations. It was primarily the physician making the determination, and because facilities were being told by CMS that these were exceptions, not routine. That has since changed, and we're really at a point now where a lot of people have recognized the need for psychosocial support for people to open up and get more visitation. So this is not currently in play. I just presented it here really to kind of explain to those of you in the family as to why there was so much difficulty early on in this pandemic regarding visitation. Next slide, please. This is also now a little bit outdated. Division of Licensing works with the Division of Office and Aging and Disabilities Services and the Maine CDC, and we have put out tables of guidance for providers. It's a little confusing, but there are essentially two tables. Table A is for the group A table are for nursing homes and large facilities, and for facilities that are predominantly for dementia or Alzheimer's residents. And group B is predominantly for smaller group home type facilities, generally speaking, less than 6 people in the residence. This table includes guidance for off-site visitation that is provided to the facilities that I wanted to make families aware of. Residents can go off-site to visit with families. Part of what facilities are being directed to do is a risk analysis, which is why they will be asking or should be asking questions to really help determine if a resident goes off-site for a family visit, what's the conditions or the parameters around what is planned to occur, and what's the risk not only to that resident, but to other residents upon that resident's return. And I know it's difficult to read in this table, but if you look at the very top, it talks about visitor and household vaccination status. All persons are fully vaccinated, including children or adult children. The resident is not fully vaccinated, then the resident should be educated about the prevention methods, masking, social distancing. The resident would be required to quarantine upon return and monitored for symptoms for 14 days. This type of off-site visit is not recommended, but it is a resident's choice, not the family's choice, the resident's choice. If the resident is fully vaccinated and the family is fully vaccinated, the resident should be educated again about prevention methods. Quarantine is not necessary unless they've had contact with somebody who is suspected of having COVID-19 or exposed to COVID-19. And let me give you an example of this. All persons fully vaccinated in the family, what the guidance or the table here and what providers are being educated about is, this is referring to my wife and I want to go and get my mother-in-law out of a facility and bring her home to have a late lunch and eat with us on the back deck in our home. My wife and I are fully vaccinated. There are no children in the home, and my mother-in-law is fully vaccinated. This visitation will be allowed. My mother-in-law would not be required to quarantine upon return. However, if my adult daughter comes over and she's a school teacher. She's partially vaccinated, but she's teaching in a school system where there's currently an outbreak. The level of risk is now escalated. And the facility needs to be made aware of this because they may determine that it might be appropriate to, and it's their infection control person that makes this decision, that it might be appropriate to quarantine and monitor for a period of time just to make sure that there was no disease transmission. We, instead of going home, like we told you that we were going to, we take my mother-in-law out to a restaurant and we go and eat indoors in a restaurant, which many people were not masked. We don't know the vaccination status of those many people. And while we were there, some friends of my mother-in-law's come over and they sit down and eat with us. We don't know their vaccination status. Now the level of risk has elevated even higher, and my mother-in-law would be subject to quarantine upon return. So that's the level of risk and analysis that facilities are doing. And really the reason why they're doing this is to protect the resident on return and also protect other residents and staff from something spreading. And you'll see in the bottom one, it talks about family visitors are not fully vaccinated. Visits should still be in a private setting with only members of one family, and it is not recommended to do an off-site visit. It is still a resident's choice, but there's a lot of education that has to occur, and if they choose to do so, then they would be quarantined upon return. Next slide, please. The table that I just showed you previously is available in full at the Office of Aging and Disability Services website. I provide it to you, it is public and accessible. I would just encourage you to please be careful as you read it. It can be a little confusing. And the facilities, you can certainly talk with the facilities about it. You can also reach out to my office, the Office of Aging and Disability Services, Danielle at the Maine Health Care Association, or Brenda Gallant at the Ombudsman, if you have questions, and we will try to assist you. The other question that we get oftentimes is, what do we do if we're struggling with a facility on visitation and they're not allowing it, or they're putting what we feel are overly burdensome or overly restrictive measures on the visitation? And my response is, the first thing you should do is try to address it directly with the facility. If you're not able to resolve it with the facility, the next best place to go is the long-term care ombudsman's office. They will work with you and the facility and hopefully be able to resolve or mediate the issue. And oftentimes it's usually a communication issue or a clarification of a standard. You can file a complaint with our office, the Division of Licensing and Certification. But I just want to make sure that everybody's clear that my office's role is really looking at, is there a regulatory violation? And it is literally a yes or no question. And quite frankly, sometimes it is a yes, there is a regulatory violation. The next question is, does it rise to a level of a citation? And that really depends on if the facility took appropriate measures to resolve it, and going forward, there will not be any additional violation. It's less likely to result in a citation. So the purpose of the citation is to document noncompliance and to ensure that there's a plan of correction to correct that noncompliance. For those that wish or choose to file a complaint with our office, we do have on our website here a link that you can file a complaint electronically. You can also call. We have an 800 number, and that is 1-800-383-2441. And it will go to a recorded line, which is checked several times a day, and leave your information, and one of our staff will call you if they need additional information and put in a complaint on behalf of you regarding the situation. And lastly, I just want to touch base, and I referenced general CDC guidance. Literally just yesterday, federal CDC released guidance stating that you're no longer required to wear masks if you're fully vaccinated, indoor or outdoor settings. However, as I referenced earlier, in that same CDC guidance that was put out there yesterday, the federal CDC acknowledged that this does not apply to healthcare settings or congregate settings such as nursing homes. So please understand the nursing homes, when they are requiring people to mask, it's not because they really want to be obstructionist. It's because that's what federal regulations require of them. And as the science is reviewed and analyzed, and CDC's, federal and state CDC, have a chance to interpret that data, the recommendations and guidelines will change. And hopefully, as we continue to increase the percentage of people vaccinated, they will change and be less restrictive, and we will be able to get more and more closer to a normal life again. But I just wanted to make sure people were aware of that. Again, please feel free to reach out if you have any questions. And I would start first and foremost, with the facility, and then the long-term care ombudsman when you're having issues, and licensing if it's really not getting resolved. I will also make families aware that the ombudsman also refers cases to licensing when they have been unsuccessful at trying to resolve them and they feel that a regulatory violation has occurred. So thank you very much for your time and attention.
Great. Thank you so much, Bill. Just to clarify your last point, because as you're speaking, I'm reading the governor's announcement that Maine is aligning themselves with the federal CDC release that you mentioned as of yesterday. So I just want to reiterate, because I know that it can be very confusing. This is not applicable to our healthcare settings in terms of not masking for fully vaccinated staff and visitors, correct? Just to clarify, because I anticipate that there may be some confusion just because there's so many different guidances, and Maine aligning with federal doesn't necessarily affect your loved one in a facility because of, how sensitive those folks can be to this disease.
Correct, because in the federal CDC guidance that came out yesterday to the general public, it does reference that the unmasking of fully vaccinated does not apply in long-term care congregate settings or in healthcare settings. So if you're going into a hospital, if you're going into a nursing home, if you're going into an assisted living facility, you will still be required to mask. Again, I think things are going to start changing. Maine, we are in a very good position. We are literally the #1 state in the nation as far as vaccination rate. As many of you heard in the media, we are slightly over 70% of our population is vaccinated. We are still seeing high cases of COVID, predominantly in areas where vaccine rates are not as high and with unvaccinated individuals, and unfortunately with a younger population or younger age group. So we are not out of this pandemic by any means, but until federal CMS and CDC guidance changes for long-term care and congregate settings, the requirement still exists as of today to wear a mask for source control when you're visiting inside one of these facilities.
Great, thank you so much. I know that this information seems to be coming at us at record pace. Well, it has been for about 16 months. So, so as always, as Bill indicated, we're here as resources for you. Obviously, Brenda Gallant and her team at the Ombudsman have been working tirelessly this entire time to really advocate on behalf of the families and the residents. And us here at Maine Health Care Association, often families will call us and we'll absolutely try and refer you back. Any last thoughts from you, Brenda, at this point before we wrap up?
Just please, if you have any questions or concerns, feel free to call us. And you can just make a call. We can answer a question. If you want us to take action, we'll do so, but we'll get your consent before we do that. But we're here to help you through this. Thank you.
Great. Thank you so much for joining us today. Thank you, Bill and Brenda, for your time. I know it's not easy trying to juggle all these things, but we know how important this topic has been to families and residents, and we're going to continue to fight the good fight and move forward. And hopefully we get that light at the end of the tunnel coming soon with Maine's really active vaccination program. So we thank you for that. So thank you so much, and have a great day.